What do you mean by vascular issues?
So one of the things we don't want to miss is something called an aortic aneurysm. So that's the largest vessel in the body that comes out of the heart right there, you see in the diagram. And so the balloon area that's labeled abdominal aortic aneurysm, it's an outpouching of that artery. And it makes it like a balloon, and that can burst actually, or leak. And that can manifest as back pain. So the first thing people will complain of is a aching type of back. Now, I don't want to scare anyone into thinking that every time it's not that frequent.
That you're having an aneurysm, right?
Right, and there are other symptoms that would go along with that. But if you get a searing pain that goes from the front into the back, that's something that a physician or a clinician would want to check. Now, even something as simple as ulcers.
Okay.
Stomach ulcers give you back pain as well. Pancreatitis gives you back pain. Cholecystitis or gallstones can give you back pain. And the reason is that the dermatomes that innervate those organs also go to the back as well. And so that's why people manifest with back pain, and we want to make sure we don't miss those other medical emergencies.
Dr. Tolchin, it seems like you have to do such a comprehensive examination of each patient, because someone that might be going in for back pain, there could be so many other conditions besides plain old back pain.
That's right, and I'm glad you bring that up, because you know, what I tell people is if they're not getting better in the expected time, then it may be something more than a muscle pull or a pinched nerve. And if they're not getting better, we need to look harder and see if there's another underlying source, like one of these more dangerous things that we're talking about.
Now, what about the psychological component to all this?
So pain itself is debilitating to people. It wears you down. And if any one of our listeners has been in pain in the past, they'll know that it just makes you unhappy. You're aggravated a lot. You're miserable. You take medicine to try to treat that, and you're not sleeping well. So you get more depressed and debilitated from pain. And that chronic pain situation is a problem. People have chronic pain for many different reasons, but when you have that kind of pain, it affects everything in your life, and then the people around you it affects as well.
Right.